Hello, this is Neil Baum from New Orleans, Louisiana. I am the medical advisor for Vanguard Communications, and I would like to talk with you about a situation that fortunately does not occur very often in our medical practices, but how to say I'm sorry to a patient when a mistake has been made. It's very easy to use the expression of I'm sorry when it's outside of a medical practice. However, stating that you are sorry after a medical mistake does not come easily. In this video, I will give you 10 suggestions on how to express an apology when a mistake has been made. Number one, apologize in person. This is not the time to do over the telephone. Make sure your cell phone is off. Notify your staff that you are not to have any interruptions when you are with the patient. Begin your discussion by stating the apology. Don't blame anybody else. Take the responsibility and state at the onset that you are sorry. Number three, demonstrate that you take full responsibility and admit that this is not the outcome that you had envisioned or thought was going to occur. Use language that the patient understands. This is not time for medical jargon. Recognize that the patient is hurt, is suffering, and is disappointed. Clearly state that you know how the patient must be feeling and that you would also like to give the patient an opportunity to express themselves and like to hear what they have to say. Be a good listener. Don't interrupt the patient. Forgiveness occurs when the patient is not interrupted by the physician. Number seven, provide a plan of action and offer to be involved with the patient and hold their hand until a satisfactory solution is achieved and is acceptable by the patient. Indicate that this is an uneventful, not expected experience, and make a promise that you're going to make every effort to see that the situation doesn't occur again and doesn't happen to any patients in the future. Also, give the patient a plan of action, what you are planning to do. Promise the patient that there will be no additional out-of-pocket costs for their follow-up care. And number 10, end your apology by repeating that you're sorry that this event has occurred and ask the patient for forgiveness. Bottom line is that mistakes are devastating for both patients and physicians. An apology demonstrates your understanding, your compassion, and your empathy. My take-home message is the doctors who admit responsibility and apologize to patients are less likely to be involved in malpractice or in a litigation. If you would like a copy of the slide deck and or the white paper on the art of the apology, I can be reached at this email address shown on the last slide. Thank you.